Greetings and welcome to the We Can't Do It Alone partnering with local government to advance statewide prenatal to three efforts. Um, Good morning or good afternoon, depending on where you are in the country. Hope you aren't dealing with unpleasant snowy weather like many of our panelists are. I am Michelle Adkins. I work with the Prenatal to Three Capacity Building Hub. We are so glad to have you join us today. And I'm going to turn it over to Arabella to start us off.
Great. Thank you so much, Michelle, and thank you for having us today. We're really excited about this conversation. So my name is Arabella Pluta-Ehlers, and I'm the Senior Program Manager for Children, Youth, and Families at the National Association of Counties. I'm pleased to be moderating today's webinar. Up on the screen, you'll see a high-level overview of our agenda today. I'll start us off by providing a brief introduction to NACO, National Association of Counties, and the work that we're doing around state and local coordination. And also share a little bit about a new resource that we released that we hope will be useful to you all in your work. We'll then move into a facilitated discussion where we'll hear from state, county, and city leaders in Ohio. And following that discussion, we'll have time for audience questions. Ingrid, if you could go to the next slide. Before I get started, I just want to take a minute to introduce our speakers. You'll hear more from them in a few minutes, but just to give you a sense of who is on the call on our end. We have sharing the state level perspective, Linan Gutierrez from Groundwork Ohio. And at the local level, we'll hear from PJ Gamble, Early Learning Policy Administrator with the Franklin County Board of Commissioners, and Matt Smido, Executive Director of the Office of Education for the City of Columbus. Next slide. So before we dive into some of the great work happening in Ohio, I just want to provide some national context and tell you a little bit more about the work that we do here at NACO. For those of you who aren't familiar, NACO is a membership organization representing county governments across the country. Nearly 85% of counties, around 2,500 counties, are NACO members. Through NACO, county elected officials have the chance to work with our government affairs team to inform federal policy efforts and work with our programs and practices teams to participate in peer learning cohorts, access resources on best practices, in a range of topics such as health and human services, economic development, behavioral health, and justice. We hear this a lot from our members that NACO is really an important touch point and a trusted messenger for county leaders, especially elected officials. So recognizing kind of that touch point that we have at NACO, for the past 5 years, NACO has been a partner of the Pritzker Children's Initiative, and we've been really focused on building momentum around the role that counties can play in improving prenatal to three systems and outcomes for infants, toddlers, and families. We do this work through our Counties for Kids campaign, which you can find at www.countiesforkids.org, which is our resource hub that shares out strategies and resources for counties who are interested in investing in prenatal to three. And a big part of our work is the Government in Action Initiative, which we created in partnership with the National League of Cities and the National Council of State Legislatures. NLC and NCSL have very similar structures to NACO, working with city leaders and state legislators respectively. So our organizations kind of came together to create this initiative in recognition of the fact that state and local governments can really influence the resources and opportunities that are available for families, which we know can have a real impact on the lives of infants and toddlers. So through our Government in Action series, we are aiming to help state and local leaders identify common challenges and actionable strategies to strengthen alignment between city, county, and state governments in support of a cohesive and aligned prenatal to three agenda for families. Through this initiative, we've held a number of webinars and virtual fireside chats, primarily targeted at our membership, so those city, county, and state government officials, to really showcase examples of what successful intergovernmental coordination can look like, and what challenges there are in doing this work. And the culmination of this work was an in-person roundtable that we held in October 2022 at the NACO headquarters. The purpose of that event was to foster relationships between city, county, and state officials. We wanted to kind of start creating policy tables where multiple levels of government can come together to share strategies, and try to make connections between our memberships at NACO, NLC, and NCSL, those government officials, help connect those folks to all of the great work that's happening at the state and local level in community groups, you know, through folks like you who are doing this coalition work outside of government. How can we bring that work together to make it more impactful? So for this roundtable, we brought together state, county, and city leaders from 5 states. And over the course of 2 days, attendees learned about strategies and best practices for prenatal to 3 coordination and had the chance to connect with their state teams to discuss challenges and opportunities. So if you could go to the next slide, drawing on the lessons that we learned from this roundtable and throughout the Government in Action series, we recently released a new resource called We Can't Do It Alone, Strategies for State and Local Coordination on Prenatal to 3 Efforts. And we really wanted to kind of lift this up to this group. There's a lot in here that I think is helpful for folks working both inside and outside of government on this issue. We kind of start the resource off with an exploration of what authorities and levers each level of government has. So where does it make sense for the city to take the lead versus the county versus the state, helping to just kind of demystify that a little bit. We know that that can be an obstacle in coordinating efforts. And then also sharing some strategies for each of those levels of government to address kind of those 3 key buckets that we think about in the prenatal to 3 space. And then, as I said, lifting up those real world examples like the ones you'll hear today from the folks on the call of how this work is actually happening on the ground, as well as some strategies for best practices in that state and local coordination. So our goal with this resource is to help our members, our state and local governments better understand the role each level of government can play and how each level of government can be partners in this work. But another big theme throughout the resource is the importance of including non-governmental partners like community-based organizations and advocacy groups in this work. So we really hope that this resource and today's webinar will be helpful for all of you as you think about opportunities to partner with local governments in your coalition's efforts. So I think Michelle is going to drop a link to that resource in the chat, but you can find it on our Counties for Kids website. And at this time, if you could go to the next slide, I will just jump right in and open it up to our speakers. We want to make sure we leave plenty of time for your questions at the end of the session. So if you have any questions that come up as we're talking, please feel free to drop those into the Q&A, and we will answer them towards the end of the session. So Linan, PJ, and Matt, thank you again for joining us today. Thank you for making it through the snowy weather to be here. And I just wanted to start our discussion by asking you each to tell us a little bit more about the community or state that you represent. What are the major challenges for families and where are the biggest areas of opportunity? And we'll go largest to smallest geography. So we'll do Linan, PJ, Matt.
Thanks, Arabella. Hi, everyone. Linan Gutierrez. I'm the president here at Groundwork Ohio. We are the statewide advocacy organization focused uniquely in the prenatal to 5 period of space. In terms of opportunities and challenges for families, we know that half of infants and toddlers in our state live in poverty. We have an abysmal infant mortality rate with a very large racial disparity. 1 in 5 of our infants and toddlers don't have access to any early learning programs, so childcare, early Head Start. And so I think our landscape is there's a great and growing need with many very young children and families who don't have basic needs met, let alone the ability to have the supports they need to thrive and create a strong foundation for their lifelong success. I think another kind of challenge as we talk in the context of state to local is that we have 9 major metro areas. So doing advocacy and making state policy change in Ohio is a challenge. We really, it's wonderful to have Matt and PJ here from Central Ohio, but you have to have Central Ohio and Northeast, Northwest, Southwest, Southeast. We have a 33 county Appalachian region. So when you think about our state and creating solutions at the state level, it is a very deep local to state strategy. It's not just we have like a couple of large cities, for example, that have a disproportionate impact on decisions that are made. Some opportunities are that we have a children's governor and Governor DeWine. So our state political context for the folks on the line. We have Republican supermajorities in both the House and the Senate, and a Republican governor. But since his first term, he's currently in his second term as governor. He's been very dedicated and made commitments in his campaign, continuing his career investing in young children. So with that, there's a lot of great opportunity in this latest budget. The governor created a brand new Department of Children and Youth. So there's a lot of consolidation of our early childhood programs to really make better solutions for kids with great leadership and Director Kara Wente. And all the while, our legislature has been really quite hostile to early investments in early childhood. So again, opportunities and challenges, but when I think about in the context of this call, nothing could be more important than building up the advocacy and the knowledge and commitment of local communities to both impact state policy as a really strong state lobby between county commissioners, mayors, local electeds, and community-based partners. And again, like just increasing that accountability structure for the challenges we have at the state, regardless of the current governor and who's the next governor, and certainly our legislature.
And again, thank you for that incredible setting the stage for us there, Lynn. My name is PJ Gamble. I serve as the Early Learning Policy Administrator at Franklin County, serving a county of about 1.35 million, obviously where the county seat is Columbus, Ohio. So also thank you for this order so I can maybe steal a couple ideas before Matt gets a chance to talk about all the great things our city has to offer. But Franklin County isn't unlike most places across the country in terms of what we're seeing specific to childcare, cost and access. However, I think what makes Franklin County uniquely challenging for our residents is the growth of the region, right? When you look at Greater Columbus and realize that we're the 14th most populated city in the country, coupled with the fact that we're expecting to triple in size by 2050. I really shudder when I think about what's ahead of us and how much work we have to do to combat all the social determinants of healthcare, including the significant impacts that's going to have on our children's early education. Housing's been a huge need. And it's really concerning considering we already had a housing shortage prior to 2008 housing crisis. If we don't really start thinking futuristically about policies that we're creating, we're going to be left with millions of consequences, intended or unintended. I say that all to say, despite the fact that Ohio's capital does not have a voter-led child care initiative, we have a lot of opportunity to get things correct. At the county level, we have a maternal health and early childhood development champion in Commissioner Erica Crawley in our Board of Commissioners as well, who's determined to create an expanded early childhood strategy that allows Franklin County residents to truly thrive and not just survive. We have a great opportunity to look around the country and explore what is working and what is not. And so we do have this opportunity to dream big and act boldly and really design a system of care for our families and their children that doesn't currently exist, right? And so when I kind of piggyback on what Lynn said, we just have this from like a sheer sense of collaboration. I believe we have a real opportunity to really coordinate our efforts with regards to policy and advocacy at the state level, as well as engage in system building with our newly created Department of Children and Youth. But that also kind of comes down to the city and county level, right? We've already participated in a lot of programming together, and I think we have an opportunity to really collaborate on things that affect our Central Ohio region much more often than we have in the past. And so I think for the very first time, Central Ohio has a real opportunity to have this linkage of care and really come together. So I'm really excited to be here and for the rest of this conversation. And I'll yield my time to Matt there.
Thank you, Arabella. Thank you, Michelle, and my colleagues, Lynn Ann and PJ. I really appreciate the opportunity to be on here with you. And the reason that PJ wanted to steal my talking points is because there are talking points, because, you know, we work together, the city and the county really work together hand in hand through almost all of our initiatives. So he's a friendly face and somebody that I talk to a lot. You know, I think our, you know, as PJ mentioned, Columbus is the 14th largest city in the country. And because of that, we have a lot of challenges, and especially the way we're growing. One of our biggest challenges, of course, is the poverty of some of the families that live in our community. We have a lot of new Americans in Columbus. We have a lot of children of color, a lot of our children who live in poverty. That is definitely one of our biggest challenges for the health and development of our children. We know that the children who live in poverty, for families who live in poverty, the challenges that prevent them from learning, from growing, from developing, being healthy. So my mayor is really, he ran on early education when he ran for mayor 8 years ago. It's one of his standards. It's one of his priorities. And he's put his money where his mouth is. He says, you know, don't tell me what your priorities are. Show me your budget, and that will tell me where your priorities are. My budget for my office is $14 million. We spend about $10 million every year in early education initiatives. Our flagship operation, Early Start Columbus, we serve about 1,400 kids a year in pre-K. Now, that isn't exactly P3, but we do a lot of work in that space as well. We also focus a lot on learning at home, because we know a lot of our kids aren't in traditional early education settings. So we work with Nationwide Children's Hospital and that really small school we have in Ohio called Ohio State. We work with them to do a lot of at-home programming for kids here. We also, as PJ knows well, because Commissioner Crawley chairs it, about 10 years ago, we developed a public-private partnership called Future Ready Columbus. And they really work in that P5 area on strategies on basic needs for families. Again, because we know that we can't just put kids in a classroom and think they're going to learn. There's a lot of things that go into the education of our children. So with strategies on basic needs, on healthcare, on infrastructure, a lot of it's very, very comprehensive strategy, and they're working to implement those things now. In addition, about just this year, we opened our new Hilltop Early Learning Center, which was a big investment for the city. The Hilltop area is one of our most disadvantaged neighborhoods. We serve about 240 kids in that community in this center. It's all inclusive. We even have a full medical suite operated by Nationwide Children's Hospital, where we serve all the children in there with preventative care, emergency care, screenings, and we open that up to kids from other elementary schools in the area as well. Again, you know, I mentioned poverty is our biggest challenge, and it really is. You know, but the opportunity I think that we have, and this is something that PJ alluded to as well, is I think just the way we work collaborative. There's a thing in Columbus called the Columbus attitude, the Columbus way, how we all work together to succeed. We have a great relationship with Governor DeWine, as Lynn Ann and both PJ mentioned. You know, we do have challenges, right? Red state, blue city, blue county, but we work very well with the governor, with his Department of Youth and Children. And we really worked well with him during the pandemic. He and the mayor spoke weekly about the needs of children, you know, in our county and our city. So that's about it. Thank you very much.
Great. Thank you all for sharing that and giving folks a little bit of context about the work that you're all doing. For our next question, I think you guys touched on this a little bit in your opening remarks, but would love to dig deeper into this state local work and kind of what that looks like and why it matters. So I'll start with Lynn Ann. Could you talk a little bit more about how you're partnering with local governments to advance your coalition's work at Groundwork Ohio? What does that look like? Yeah, we'll start with that, and then I'll have another question for PJ and Matt.
Sure. So certainly in all of our work, and more specifically in our prenatal to 3 coalition work that I know of, a lot of our audience members are engaged in the same work in other states. We launched this particular initiative focused on infants and toddlers right the month before the pandemic began. And so we went into this with a number of different strategies, one focused on both county commissioners and mayors, so local elected officials, with the primary purpose of really building them up as a strong lobby to lever state policy, knowing that in many instances they act individually on behalf of their community. They also act in as a group. So through our state county, the County Commission Association of Ohio, we have the Ohio's Mayor's Alliance, and and then kind of secondly, this was our thinking going in, was we know that they are also implementers and initiators of policy and investments in kids. But from a statewide perspective, we're really trying to focus on that first priority. We have a unique relationship. So the CEO of Groundwork Ohio, Shannon Jones, is a sitting Warren County commissioner. So we began to experiment a little bit with asking questions and trying to create dialogues in a number of different counties to see where they were thinking about the prenatal to 3, prenatal to 5 space. And overwhelmingly what we found is there are a lot of excellent people working in programs, but none of them were ever necessarily in the same meeting at the same time talking about babies and toddlers. And so a great example was the home visiting program leader, or I'm sorry, the child welfare coordinator was noticing an increase in infants and toddlers in her engaged in or under state custody. And she really had no idea at the time that how many of those children may be engaged in home visiting in the same county, same program. So those types of connections just started a bit of a natural dialogue and learning for us. But with the pandemic, and then with the federal relief packages that were coming down to the federal government, there was also this unique opportunity for counties and cities, I think, to think differently about the type of investments they could be making with these new financial opportunities to kind of meet the need and the crisis. Because oftentimes we were sort of finding where the first open door for counties was really in the child welfare system, because they're administering child welfare agencies, across counties in the state. So what evolved over the course of a few years, certainly with ARPA funds and our partnership and growing relationships with both county commissioners and mayors, was we did a cohort, a learning community of about 13 county commissioners, for which Commissioner Crawley from Franklin County was a part of. And she was a previously in the Ohio legislature. So she was a champion at the state legislature, and then coming back to the county. And so you have that natural alignment going both ways, right? That people who are in office oftentimes come to the state or go back to the county, which are good relationships to have for this work as well. That we really learned with a number of rural and urban counties, just the choices they were making, and trying to provide them a framework to think about how investments and certainly the ARPA funds could be utilized for very young children. So at that point, we began really tracking a number of different investments, certainly Franklin County RISE, being one of the really major examples of the potential of what federal relief funds and this unique county city partnership could look like. To really educate and, again, build that natural infrastructure for early childhood advocacy among local communities in a stronger way. And I think what we're beginning to see now, and what we hope now for the future, is turning back to that. Okay, now we've learned many more local communities have kind of skin in the game, if you will. We have a couple other communities across the state that may be on having local ballot initiatives around early childhood to grow that cohort of communities who have local tax dollars or local public-private partnerships to ultimately get a large state investment and really secure the state system. All of our local communities are really last dollar in. They're building on the state framework. They know they can't go it alone. And we know at the state level, we can't go it alone. So how are we forcing each kind of component or each level of government to be a full partner in solving the problems for young children and families is our ongoing focus. So I'll leave it there.
Yeah, thank you, Lynn Ann. That's really helpful. And I'll just add a little bit of context to Nico. We had the chance to work with Groundwork and the County Commissioner Association of Ohio in setting up that learning cohort. And it was a really great opportunity a really great experience. And I think the state associations of counties and state associations or state municipal leagues, almost every state has them. And I think they're kind of a secret weapon in this work. I think that there's a lot of potential to tap into those groups, to think about, as Lynn Ann was saying, how, you can leverage local leaders to be not only the implementers, but a lobby, a group of folks who can inform the state priorities, and who are seeing this work happen at the local level and have a voice when it comes to the state policy. So, if you are doing this work and you haven't connected to your state association of counties or your state municipal league, and you would like to, please reach out to me. I can also connect you with folks at NLC, and we're happy to think about how that can be a piece of your strategy.
Thanks. And I'll just tack on that, for the first time, we saw the County Commission Association of Ohio include in their policy agenda, there is a headlined section prenatal to 3. So, again, they have lots of priorities. They're meeting lots of different needs, but that was a good tangible kind of nugget for folks to work towards how to get to.
Yeah, absolutely. Great. So then turning it to PJ and Matt, kind of the same question in the inverse. Anything that you all want to share about, you touched on this a little bit, but how your communities are connected to state level efforts and, maybe how this shapes your kind of day-to-day work in your local communities.
Sure. I mean, I think at the county level, we have the most direct connections to state level efforts, considering that we are mandated to work through a health and human services lens, right? In collaboration with the state of Ohio, through our job and family services relationships, things of that nature are the most apparent ways that we engage on that type of level. So day in, day out, we're engaging with families that need us the most. We're licensing childcare providers. We're training them on our state's quality rating and improvement system, Step Up to Quality. And we're operating, obviously, our publicly funded childcare systems. Where it becomes challenging is when those mechanisms fall short of the needs of residents. Knowing that Ohio is really, one of only a handful of states that reimburse childcare providers at the 25th percentile of the local market rate, meaning our lower income families qualifying for PFCC have access to the least expensive 25% of childcare centers in the area, right? Often lower quality. That idea that no states are lower is really heartbreaking to me. And so I think that's what makes things challenging, is when our efforts and our mandates to collaborate really don't meet the needs of our residents.
And I would say, unlike the county, who, because of your mandates, you do work a lot with the state. The city, doesn't have a lot of official interaction really with the state. Unofficially, we do. During the pandemic, we did a lot. We worked with the governor's office and Department of Job and Family Services when we wanted to provide pandemic relief to early learning centers and families. The state was doing the same, so we worked with them a lot just to make sure that we weren't penalizing our families by offering any type of support that the state was doing also, which would then maybe make them ineligible for receiving any state support. I mentioned, there are some difficulties with red state, blue city, issues. But again, we work really, really well with the governor's office. We do one of the things that we do is that we braid our city funding for our early learning spots, because we cover 100% of tuition. We braid our city funding with Title 20 subsidies and the state's early education expansion funds, so that we give each early care seat about 13,000, per slot, which we really feel is needed to provide a high quality education. Most of our work, collaborative work, is with the county, is with Commissioner Crawley and PJ in his office. We have so many programs on which we collaborate. I had mentioned our public-private partnership, Future Ready Columbus. The Commissioner Crawley chairs that. The mayor used to chair it. He's still on the board. We have several councils as part of that Future Ready Columbus board. Numerous state, county, city individuals, as well as advocates who are on that board, and who are on those specific councils that work together to try to serve the needs of kids and families who are in that P5 space.
Great, thank you. And I have Lynn, I have kind of a follow-up question on the same topic. And PJ and Matt, feel free to chime in. But I'm wondering, Lynn, if there's kind of any like lessons learned that you're seeing in, something we talk a lot about at NACO is thinking about local governments as kind of sites of innovation and labs almost. And you kind of alluded to that with the ARPA funding, that cities and counties had a chance to really try out these new creative approaches to investing in childcare and other prenatal to 3 services in ways they hadn't before. At the state level, are you all kind of working with communities to identify those pilots and best practices and thinking about how that can inform state level work?
Yeah, absolutely. I will say, I think we do a pretty good job of that. And that's really been Groundwork's frame since its inception, was this local to state strategy, including community-based leaders, advocates, other collaboratives. So, particularly in the urban areas, there are similar type of collaboratives and partnerships happening at various levels. What I do think has been very frustrating is when we go to the state legislature and we say, it is not yet changed the political will of the legislature. And so, I think the strategy has to continue to be increasing these innovation, but where communities have been doing this, have proven results, are identifying unmet needs, and are sometimes more astute than our the state level to notice where there are these gaps. It has not yet been heard at the at a level where we can really shore up our state's early childhood or early learning systems. So I think having more communities on board is really important. I mean, one, PJ and Matt's collaboration, and the governor and the mayor and the county commissioners collaboration is fantastic. It is not it is not happening in all of our counties, right? And so many of our rural counties feel very left out, and as a result, the state policymakers also have a chip on their shoulder, legitimate about the amount of resources that they may have to solve problems for their residents, where there aren't these public-private partnerships. There's not the infrastructure for these types of collaboration. So again, all the more reason to build out as many different kind of community partnerships and really elevate both needs. But we have long been sharing kind of the gap and the need to sustain, for you all, for Franklin, for the Franklin County Rise. I mean, you all, will you be able to sustain that level of investment forever if the state doesn't come through? You took a risk in saying we have to do this. This is the right thing to do for now, but in hopes that either both the federal and the state government, that more resources would be coming to help, and that hasn't come to fruition yet. neither by Congress or through this last state budget. So that's where our work is really focused. So we need to continue to articulate that story. But there's widespread frustration that it hasn't been heard.
Yeah, I definitely will agree on that, right? Those are things that we are challenged with at the county level, right? That's really where the rubber meets the road, right? It's evident in these types of investments that we're making. So to provide a little further context, just coming out of the pandemic, a lot of local community stakeholders came together to really discuss through a recovery and resiliency task force what were the needs of the community and how could we support a lot. Obviously, there were a lot of points pointing back to early education and childcare, to which point the city of Columbus and Franklin County came together to discover how we could maybe address these, right? And so we partnered up with our local resource and referral agency, Action for Children, to create what is known as Franklin County RISE. You can learn a little more about that at rise.franklincountyohio.gov. I believe that we can drop that into the chat. But ultimately, this has now become a bit of a 4-year, $40 million pilot, right? That provides childcare scholarships to families, quality improvement incentives to providers, as well as earmarking dollars for educators for emergent housing needs, right? And so what that impact ended up leading to was about a little over $10 million awarded in scholarships. We served just under 1,300 children. We had about 100 positions filled in awarding and signing bonuses. We gave out another $3 million in incentives, and we expended almost all of our emergency rental assistance funds, right? And so to Lynn-Ann's point is, how are we going to sustain that, right? And so we're taking this opportunity to use this model as a bit of a stress test, right? A stress test to not only our community partners, but a stress test to our administration to say this is the type of investments that need to take place and more. And what are the mechanisms that are going to allow us to do that? Is that going to be our GRF funds? Or is that going to be some other type of initiative that needs to be talked about broader? And so those are a part of the reason why a role like mine is created at the county level. For further context, my role is brand new, right? And so being that we are one of the few regions in Ohio that does not have a voter-led initiative, we are really now kind of laser focused in on what does our expanded early learning strategy really look like. And so my role is really kind of meets at the intersection of the exploration of strategies across the nation and policies across the nation to come back and make recommendations to our Board of Commissioners. The creation of said strategy and implementation of that strategy. And then obviously a lot of policy and advocacy work. So like I said, we're really laser focused on trying to figure this out, but things like Franklin County RISE are things that we can continue to do and tinker with.
And I would just add that sustainability is definitely something that we think about and we talk about all the time. When we started this work about 10 years ago, since then, I think the mayor's put about $100 million in early education efforts through our office. But unlike the county, the city doesn't really have a human services focus, a lens really. A majority of our work are, public safety, fire, police, utilities, trash collection, and neighborhoods. And we are, we're fighting to maintain this level of support where we're also having, issues that lead into this, such as homelessness and shortages of affordable housing, and a lot of new Americans coming in our community. We're seeing a spikes in youth violence and safety issues. So we have a lot of competing challenges. But, you know, the reason that our mayor got into this about 10 years ago is because he saw that there was a need, a great need for this for our families and for our children. You know, we looked at a lot of data that shows that our children weren't doing well. They weren't doing well in school. And that is, of course, a predictor, an indicator of how they're, you know, how they were doing at home as well. So he said that we need to start something. We need to do something because we can't wait on anybody else. You know, specifically the state, the federal government to help our kids. We have to act. We have to do something now.
Yeah, I was just reminded, I know I shared a few data points on the front end, but our kindergarten readiness scores have gone down across the state during the pandemic. And for low income kids, there's 80% of low income kids in the state are not ready for kindergarten. You know, so the call to action is just urgent and real, and not only from an investment standpoint, as more and more communities where possible are looking at voter-led initiatives to get around the real challenge at the state to get real true resources dedicated here. It's not only investments, but it's also policy. So these local communities make assumptions around programs because they're not the only investor. And when a policymaker at the state level decides that the kindergarten readiness assessment should be changed or taken away, the state quality system and whole regulatory scheme should be changed. When they're undercutting investments and policy, it further strains the ability to even sustain and measure impact, I think, for local communities as well. So among this fight for resources and sustainability, there's constant threats, kind of paper cuts to the system with an alarming frequency that really undermine the efforts, I think, of a lot of the local communities as well.
Arabella, can I just follow up on that too? Lynn Ann mentioned the KRA test and the importance of these types of investments. The kids who take or participate in our Early Start Columbus program, which of course is our pre-kindergarten program, they test on average over 10 points higher than the kids in the statewide report. And then also the kids in the lowest band, we only have about 15% of our kids in the lowest band. I think statewide there's 35. So we do assessments, pre and post assessment, and then mid-year assessment to see how our kids are, and we implement interventions. And then we track those kids and see how well they do in the KRA. So, I mean, we have hard evidence to show that these types of investments work, especially for disadvantaged kids and kids of color, because that's all we serve.
Yeah, and I would like to commend the collaboration from the city and local school districts, right, on some of that data sharing, right? You don't, in most cases in our field, because there is no true system that exists, you often don't have that conversation and that linkage back to that KRA, right? So oftentimes we have providers operating in this space of not truly knowing, you know, they're assessing their children, believing that they're kindergarten ready, and then but not having that data sharing agreement in place. And I think that's really that first domino. And like I said, I really commend the work you do on Early Start Columbus to get that information back, because that's critical to making sure that we can continue to see improvements. To Lynn Ann's point, right now these numbers are abysmal, and we really have a lot of work to do.
Yeah, thank you all for that. And I think something I just want to point out that came out in your answers. I mentioned in the resource that we have, the We Can't Do It Alone resource, we kind of got into that piece about different authorities and levers at different level of government. And I definitely heard that coming up as you all were talking. You know, PJ, you were talking about how the county really does have that human services lens, and that's not necessarily the city's priority. And I think that's just such a great example of why it's so important to be having these conversations, to have these tables where folks are coming together, because, you know, it's probably not in the best interest for the city to try to develop this human services lens or practice when they could instead just be partnering with the county, who is, you know, mandated by the state to do that work. So I think that's just a really great example of, you know, making sure that we're aligning the actual investments and initiatives, but even just thinking about kind of the role that each level plays in these efforts. We only have about 15 minutes left, so I do want to make sure that we're able to answer any questions from the audience. And I see one in the chat from Kathy Storr. And she has shared some other context there, but it looks like the kind of core of her question is thinking about, you know, how can we think about framing this issue? How can we get the needs of young children onto agendas and really make sure that prenatal to 3 is top of mind, especially when we're talking about other topics like community development, transportation, and public safety. So I'll just open that up to the group. Anything you want to share about how you're doing that kind of public will and, you know, even narrative building around the importance of infants and toddlers across all policy areas.
I'll say, we stay out of that space. We strategically and specifically do not advocate for the, I don't feel that that is that is my office's role, nor to a degree is it a role of our public-private partnership, Future Ready Columbus. One of the reasons is because we have great other partners who do that work, such as Groundworks Ohio and a few other organizations that we have that do that advocacy so well. I want to keep their message pure and not really mix it with some of the things that we do. And when we do need to advocate, we're lucky to have that link where the mayor can just pick up the phone and call the governor. That's, I think, probably if we were to do advocacy, and we have in the past, that's what we've done.
Yeah, it's interesting for us, right? Where, again, like I said, the biggest failure for us is when mechanisms aren't meeting the needs of our residents. So I think we do have, at the county level, do have a bit of a call to action when we, we've got, obviously Columbus is our largest city, but we've got, 13, 14 other cities, 17 villages, 10 townships to think about, right? And so we do have some level of government affairs, intergovernment affairs that we really have to think through. And so I think that's moving forward. I think we really have a true opportunity to work alongside of our partners, Groundwork Ohio, and make sure that, as we are developing our strategies, we are making sure that we are considering the advocacy points that we want to take to the State House and the budgetary things that we want to see in that budget, right? Particularly a lot of the things that the levers that we have to pull, PFCC, reimbursement, things like that, really have to be initiated at the state level. So I think at the county level, we truly do kind of need that advocacy as a priority. I think we have to be strategic of how we use it. But I think there is definitely a lane for us at the county level. And so moving forward with my role, I think we'll be working a lot closer with organizations like Groundwork to see those initiatives come to fruition.
Yeah, I'm biased. It's hard for me, to hear, and I understand the nuance and the distinction, but I really view everyone as advocates. So even your act of investing and being dependent on these, it is to me advocacy that we all rely on. I do think there's going to be a continuing need, even if it's outside of city and state government, to have local advocacy funded as a pipeline to the state. We're strong. We're always going to be there. We're in every office in the State House, and they really want to hear from you all. And they do, right? Like your members know what it is that you need. You have those lines of communication. So, we're always just trying to continue to have, and support leaders to be able to use those levers when it makes sense and determine kind of the urgency at any given time in the state budget process or whatever, where that would be really needed. I also sort of saw, though, in Kathy's question, I think one of the things that we've struggled with at Groundwork, both in our mission work and certainly in the unique Prenatal to 3 coalition focused work, is how you make the connections, like Matt, from your primary city responsibilities to pregnant women, infants, and toddlers. And I know we've talked a lot about childcare, but the mayor really championed Celebrate One. So Maybe you could talk a little bit about the framing of how you make those connections, even where it's not a direct connection to workforce, for example, around why should that be a priority?
Yeah, thanks, Lynn. Celebrate One, fantastic. Another one of the mayor's top priorities, and it's a different office than mine. So I'm not as intimately familiar with the details, but a great effort that the mayor started when he was on city council, actually, the goal of making sure all kids in Columbus reach their first birthday. You want to talk about collective impact work. This is a model of collective impact work. And it is both high level and really, grassroots type work where our coordinators go into every single home, every child that is born in Franklin County. There's a Celebrate One coordinator visiting that family, talking to them about the importance of safe sleep, giving them resources, making sure that they get to their dog. Mom gets to her doctor's appointment. Really, again, a study in case management. Not only do they, set up appointments for these moms and babies to see their pediatrician or their OBGYN, they take them there, they sit with them while they're there, they bring them home, they follow up with them after the appointment, they make sure that they have resources, they make sure that they have food. It is really a really comprehensive approach we do to making sure those kids reach their first birthday and that both kids and moms are safe and have what they need. And then from there, we link them into other resources as well. There's a coalition that works together a lot, which is Celebrate One, which again are getting our kids to our first birthday. Future Ready, Columbus, our public-private partnership, which is our P5 organization. Myself, which primarily focuses on 3 and 4 year olds, my office. And then our partner, the United Way of Central Ohio, who has a Success by Third Grade initiatives. So we see that as a longitudinal effort from kids, really from prenatal to 3rd grade. We meet regularly and discuss our strategies and see where our work aligns and where there are gaps and where there's opportunities as well.
Yeah, thank you for sharing that. And I think something that I also saw in Kathy's question was, thinking about advocacy broadly, not necessarily when we're talking about like advocacy to the state legislature, but just kind of being a champion for infants and toddlers and how we're, getting those folks on the policy agendas. So PJ, I was wondering if you could talk a little bit about what the conversation was like with the component that you all have in Franklin Rise about the housing dollars for childcare providers. I think that's a really great example of, when we were thinking about those emergency rental assistance funds, not a lot of people are thinking about childcare providers as a population that we need to seek out and target, but that's something that you all did in Franklin County. So just wondering if you could share kind of any approaches to that work.
Sure. I mean, right. So, I mean, when I think of advocacy, I think of it even, I think we oftentimes think about it simply at, the policy advocacy work that we do at the State House when we think about this government advocacy work. But we're also like really advocating to our public-private, collaborations, right? So we think about some of our corporations that are here in Columbus and making sure that they've got skin in the game too. But to your point, right, the emergency rental assistance aspect of Franklin County Rise, in year one, we used ERA dollars. Year two, we actually are using ARPA dollars. But $1 million that we invested or earmarked rather, specific to early childhood educators. On average, educators can receive a payment up to $3,000 to help with emergent housing needs, kind of, sticking to kind of those ERA eligibility requirements that we see in most of our jobs and family services across the state. We served, upwards of 150 educators with these dollars, almost exhausted the entire pot in year one. Just now getting it kicked off here in February 1 for our second iteration of this program. But no, you're correct. Like advocating not only just for the P3 space, but the educators and the supporters of everything that kind of encompasses that work, right? And so there's a ton of ways we can be advocates. I'm even thinking about, right, how do we advocate for other guardians and, you know, in kinship space, right? When I think about all the things that the government or the county government is responsible for, we've got all these different pots that we've got to advocate for, right? And there's a lot of work to do in the kinship space. And so I do see us as advocates. We're not there as often. We kind of leave that to a very specific person in a very specific department. But I see even, you know, opportunities like webinars and conferences, right? And getting to additional collaborators and additional peers across the state as advocacy. And so like I said, I'm probably not at the State House nearly as often as Lynn Ann, but and I probably need to be there. Someone in our office probably needs to be there a little more often, but I definitely see us as, you know, these advocates and things in these spaces.
Great, thank you all. So we're almost at time, and I want to be mindful of folks' time, especially on a Friday afternoon. Any closing words that any of our speakers want to share before we wrap things up? Any advice for folks on the call, or things that you didn't get a chance to talk about that you want to give a shout out to you?
I just say thank you to my partners here in Ohio, Lynn Ann and PJ. It's always wonderful to work with you, and thank you.
Sure. I wouldn't say there's a ton of things that we didn't get a chance to cover, but you know, in terms of advice, I definitely say it all starts with having a strategy, right? And so all of your priorities and spending are aligned. I think the last thing we want to do is throw taxpayer dollars at programs and solutions that are not in lockstep with our vision for our communities. For us, it's the creation and our commitment to our Rise Together Poverty Blueprint, which is our community anchor for coordinating short and long-term goals, mitigating poverty, and really fostering equitable access. And so this plan really consists of 13 goals and 120 action steps. And every resolution that we pass, every dollar that we spend has to point back to one or more of these goals, which was really resident-led in its creation. So I definitely say it starts with that. Beyond that, I also say share generously and steal liberally, right? Don't be afraid to steal great ideas from other thought leaders across the country. I say that lightheartedly, but I do find the time to build relationships across the country to learn from their challenges and successes of existing programs and pilots, and how we can maybe iterate those here in Central Ohio. And so those would be the bits of advice I would have.
Yeah, thank you again for the opportunity and for our Ohio partners. And I would just say for folks in the audience that are like me, are on the advocacy side and coalition building side, looking across at the state level, certainly it can be overwhelming about which audiences you may choose to build up and really invest in those relationships, whether you're thinking about how to build a business coalition or a local electeds coalition, or you're focused on families. It's all the things all the time. I get it. And, I would just not count out the opportunities that you have to build relationships and plant seeds with local policymakers, whether it's through community-based organizations or a statewide organization, with the caveat that it, like anything else, it takes time. And I don't think we would have known what it would look like, several years ago. And, it just so happens that I'm on this webinar with Matt and PJ, and I talked to Future Ready 5 today, but I don't necessarily get to connect with them all the time. But the feedback loop continues, and the work is really progressing. So, and there's more to build on today than there was a few years ago, and there will continue to be. So just a patience and on the state side, where there are so many opportunities and relationships to build, that this local to state strategy, I think can be very, very powerful, and we're going to continue to try to leverage that. So don't count it out.
Great. Well, thank you all so much. Our contact information is on the screen if you want to learn more from any of these presenters. If you are trying to make inroads with counties in your state, please reach out to me. I would love to think through that process with you. And just want to say a thank you to our speakers for joining and to Build for having us. And I will turn it over to Michelle to close us out.
Just a quick shout out for the Prenatal to 3 Exchange. It's a gathering of all sorts of people, experts, organizations, public and private, that come together to talk about prenatal to 3 subjects and ask questions and build conversations. I put the link. Did I put the link? Thought I did. I will put the link to the exchange in the chat. And thank you so much for sharing some of your time with us today. Hope you have a great rest of the day and a great weekend. Thanks.